According to the American Cancer Society, death rates from cancer in the U.S. have declined steadily over the past 2 decades due to more people getting early screening as well as years of innovative research and technology. Oncologist Dr. Coty Ho reveals the successful new treatments being done in cancer today.
The buzzword for research in cancer at this time is immunotherapy. So the idea is that we like for the human immune system, our own immune system, to fight the cancer. All cancer cells come from our own body. It's part of us. But for some reason, as it's growing, it decides to mask itself. It escapes the detection of our immune system. So the idea is to understand how that process occurs. How does it escape our immune system and able to live and survive? So once you understand that process, you can target certain drugs that unmask these cancer cells and allow it to be detected by our own immune system and then to destroy it. The beauty of all of this is that it's a more targeted way of attacking the cancer than previously. In the old days, when we give chemotherapy, we indiscriminately destroy any cells that are growing fast. So it's an old concept, all cancer cells grow fast, but unfortunately, some of the normal tissues also grow fast. For example, our hair follicles, our nail beds, cells in the gastrointestinal tracts, all those grow very fast. And so, unfortunately, they are collateral damage when we do systemic traditional chemotherapy.
Therapies to manage cancer are helping patients live longer.
For 2 patients with the same diagnosis, for example, lung cancer, it can be totally different because of the genetic makeup of each one of us are different. And as our technology gets better and better, we can personalize and we can tailor the drug and the treatment to individual patients. Patients usually don't die in stage 1, 2, 3, or even 4 unless it metastasizes, unless it's spread. So we control that spread. So even in stage 4 disease, the patient can survive. And so we're talking more about manageable disease, getting the patient to live a little bit longer and much, much longer later on as our drugs become better and better.
Treatments are now having success with fighting melanoma.
The best success I've had so far is in patients with melanoma. Melanoma is cancer of the skin. And it starts in the skin, but it can infiltrate and it can spread to other parts of the body. There's a particular mutation that we detected in melanoma called the BRAF mutations. And when I was in fellowship, there wasn't available this medication. If you have metastatic melanoma, it's a automatic death sentence almost. And the nice thing about these medications is that they're pills, they're not intravenous chemotherapy like before. The side effect is very minimal. Sometimes they get a little skin rash, but they tolerate very well. And the nice thing is that when we scan them, the previous cancer that we've seen on the scan are negligible. We're not seeing them anymore. Traditionally, in the past, we don't have very good medication to control the growth. Until recently, when we find out about all these, not only the BRAF mutation, but also the immunotherapy that we have now. And all these medications are coming into play, and the patients are living longer. And again, as I mentioned, we're seeing complete remissions in these patients.